Hey guys, this is Bryn with the Mama on the Rocks, and I'm here with our expert interview for our paid extreme parenting community. And every week I feel like I'm so excited, but I really am so excited. I would not waste my time with an expert that I didn't feel wasn't an expert in their field, and I wasn't excited to learn from them. So this particular expert, Stephanie Hunt, is somebody who, to me, I've known her for, it feels like 100 years. Stephanie used to work, I would say work with me, I guess technically work for me. It's, six of one, half a dozen of the other, when I managed a boys group home for boys in the custody of the state. So we worked with adjudicated youth. None of them would have chosen to be there, I don't think. Maybe some, I don't know. And so we were what was considered a level 1 facility. So though our boys were on lockdown and they were mandated to be there, they had a day room. They were not in cells. They shared a room with another roommate, another resident. And so we saw a lot of mental health diagnosis, a lot of trauma, a lot of adverse childhood experiences. And so one of the things that I've kind of adored with Stephanie is being able to see her as what I would say is like a tiny baby therapist, even though she was just starting out in school. And I got to see her in direct care with boys of this caliber, and then going into working for a foster care and adoption placement organization where she was able to work on reunification with families and things like that, which is so important. And then also get her graduate degree and work in trauma care. And I just love that so much. And so I wanted Stephanie to join us today to help us, because we talk a lot about red flags in this group. We want to talk about trauma, because even as parents, and even as much as we know our kids, bio kids or adoptive or foster care kids, sometimes we miss it. They're right in our face and we miss it. And we talk a lot about big T and little t trauma, and there's a lot of trauma that we don't recognize as trauma or label as trauma. And so I want to, of course, educate as much as I can. So Stephanie, talk to us a little bit. Tell us about yourself. Tell us, what all your letters are, but also why you're where you are, because you've done some really amazing work in some really incredible and difficult populations.
Yeah, so I kind of started out with why I chose this field of work. I had a traumatic childhood of my own, have some diagnoses of my own. And so when I went to undergrad, I majored in psychology just because it felt like I could try to understand myself a little bit better. I could start to figure out why I am the way I am and sort through all the things that had happened in my own life. And then while I was in college, a family that I went to church with was fostering. And so I kind of got to see that process up close, learn about foster care, and I really wanted to be part of that system, part of making it better, because I saw all the trauma that occurred with visitation and going back and forth. There's just so much stuff in the system that I wanted to see change.
Sure.
Which is a big dream for an 18-year-old.
It's a big dream for anyone.
Right. Once I graduated, I started out in residential working with you. And man, have I grown since then, because I was like the most sheepish, shy person. And you taught me a lot about connecting with the boys and how to be more assertive and why it's important to give them boundaries. And that's where I started learning about boundaries, which is huge for me along my journey.
Sure.
And then I was able to move up to case management with foster care. And as I was doing that, I was realizing I'm really not making as much difference as I hope to. Because I'm just seeing these kids experience this trauma, and I'm doing the best I can as a case manager, but my knowledge is limited.
Sure.
So after about 3 years of that, I decided to go to grad school to get my degree for counseling. Once I graduated, I went into an elementary school in Johnson City, started doing therapy in a school. Didn't love that because the families didn't really participate as much as I wanted them to. And I got the opportunity to go back to residential, which was so exciting for me, because as much as I struggled working in residential the first time, I grew so much as a person.
For sure.
And in residential, you get to work with the families, and I felt like I was able to really make a difference. We did art therapy group and drug and alcohol group, and it was fun. I loved the job. But my husband and I ended up moving. So we moved to Louisville, Kentucky, and I have been working in foster care again. So I started out as a foster care therapist, then a program director for foster care, and now I'm the clinical program director for the company that I work for.
I feel like you're
So
my kid right now, and I want to like hang all this on my refrigerator. I'm so proud.
thank you. It's been a long journey. Yeah, so I am licensed in the state of Kentucky, LPCC. I have done some work, I'm not certified, but I've done some work in trauma-focused cognitive behavioral therapy, Pcit, which is parent-child interaction therapy, ARC, few different types of trauma therapy, not certified in any of them, but I know them pretty well and use some bits and pieces of all of that in the work that I do.
Sure. And we've talked in this group because most everybody here has or is currently taking their child to some form of therapy. And we could sit here and name off 20 different kinds, but because we're a little bit more well-versed in the sort of types or the modalities of therapy, just so that you guys know, and I've said it before, but in case you've missed videos, CBT, basically behavioral therapy. So
Yeah.
last week, our expert talked about EMDR and mindfulness and sort of top down and bottom up ideas. And so that's pretty common for our children to first be exposed to CBT because it's very structured. It gives them and us sort of like homework assignments, strategies. But from the flip side of that, because I've been both on the parent end as well as the treatment end, it's important for us to recognize it doesn't work for everyone. And sometimes it works best when paired with something else. So it's not sort of a one size fits all go-to. So what I want to talk about at first is trauma, like you mentioned. So if you're thinking about kind of like a Venn diagram of diagnoses, for lack of better terminology, ADHD, sensory processing, even the autism spectrum, there's a lot of overlapping or comorbidities or co-occurring conditions that we see in this group. That are very common and widespread. You think about something like ODD or DMDD and ADHD. That's super common, right? Talk to us about some of the red flags that are actually may be indicators of trauma for our kids that even though it maybe isn't a misdiagnosis, but if we can address the trauma, so we talk a lot in this group about addressing the root and not just the symptoms, that we need to be aware of as parents. What kinds of things can we be looking for?
Yeah, so it's a little bit of a gray area because all of those diagnoses have really similar symptoms. I did write down some different trauma responses to look for, but like I said, there's going to be a lot of overlap.
Sure.
So you're looking for several different types. So emotional responses, physical responsive, cognitive responses, social, behavioral, developmental. Developmental, with trauma, you're looking for any kind of regression or decline. So a kid who used to be potty trained, who no longer is potty trained or having accidents at night, a kid who stopped sucking their thumb or carrying their security blanket and now they're doing it again. So you're looking for any kind of regression there. Inability to concentrate. Again, that overlaps with several other things, but that could be because their brain is overloaded with, am I safe?
Yes.
There's some repetitive play. You can learn a lot by watching your child's play. Repetitive play, any themes in the play, that type of thing, and a decline in school. So somebody who used to be really good at reading now hates it, doesn't want to do it, good at math, not good at math anymore. Socially, you're looking for relying on others too much or pushing others away. Any kind of attachment issue can be indicative of trauma.
And let me remind anybody who is at this point in the video, if you haven't watched, there's two videos actually at this point with Dr. Christine Browning. She talks a lot about attachment styles and that effect on trauma, specifically childhood trauma. So if you haven't watched that, I would really strongly recommend you go back and refer to that because she's got some really important insight there. Go ahead.
Yeah, sorry. She is good expert on attachment stuff. Inability to trust, difficulty connecting with you, seeing just the world as a scary place. There's a lot of fear, and then seeing themselves as wrong all the time or worthless. Some behavioral things to look for: aggression, impulsivity, compulsions, manipulative behaviors, anything about control, trying to control their environment, control themselves, other people. Learned helplessness is a big one I've noticed. they're too afraid to try. There's no self-efficacy there.
Mm.
The inability to make decisions because they're scared they're going to make the wrong one,
Yeah.
and anxiety. Let's see, extreme emotions and shame in particular, self-injurious behavior, any kind of disordered eating, eating too much, not eating, being really picky. If your child wasn't previously a picky eater and is now trying to control that. Let's see, feeling too much or too little. If you notice that your child is like starting to feel numb or detached, that's a really big indicator.
Yes.
In depression. Some physical symptoms, somatic complaints, which are physical complaints that there really isn't a good medical explanation for. Headaches, stomach aches, that sort of thing. Sleep issues, enuresis or encapresis, which is basically going to the bathroom on themselves. And then cognitive issues is just noticing any changes in their belief system about the world. Again, the world's not a safe place. You can't trust people. I'm worthless. Misinterpreting comments or actions, I notice that a lot in foster kids. If you're telling the child to take out the trash, that's immediately misinterpreted as they've done something wrong or they're wrong. There's survivor's guilt sometimes, depending on the type of trauma. A lot of times, kids will idealize the perpetrator. So the perpetrator is still a good person in their eyes, and you're not going to change their mind about that because they need to believe that about this person.
That goes back to attachment as well.
Yes.
Yeah.
And then sometimes delusions or intrusive thoughts. So those are some red flags to look for with trauma. But again, those can also be several other things. So it goes back to finding a therapist who can do a really good assessment on your child.
And if you are listening to Stephanie, and I, of course, I'm always thinking of our own extreme child, and I'm going, yep. And so two things kind of came up for me. One is, and I'm super guilty of this, and part of that is my anxiety, part of it is my OCD, but you can't blame yourself, even though that's maybe your natural go-to, is, yeah, I've been with this kid all the time. Holy cow, did I miss something? Did I let them stay with somebody that was unsafe? Did I this or this or this? But I'll go back to something that Dr. Browning talked about in a video. It's important for us to remember that trauma is how we perceive what happened to us. I mean, that's straight to the definition. So it's not, yes, trauma is surviving a rape, surviving a car crash, surviving a house fire. There certainly those are traumas, but it's also how we see what happened to us. So if I go into my own experiences, how my brother, who lived in the same 1,000 square foot home as I did, viewed our upbringing and how I viewed it are wildly different. Even though I'm like, how did you think this happened? I was there the whole time. But it's true. And so that is important. And if you have kids who have justified diagnoses, and so maybe they view themselves or the world differently, they may have some of these things that are just naturally occurring in their brain without necessarily needing a major trigger for that to have happened.
Yeah, trauma is very subjective. It's anything that happens that you perceive as dangerous to yourself. It could be as simple as me and my husband arguing and a child is scared because that upsets their world. It makes them wonder, are we going to stay together? Are we leaving? Anything that, their little brain goes to that can make it traumatic for them.
So that's super important, number one. And number two is, so not blaming yourself, but to get a good assessment, like Stephanie said. Find somebody, and I talk about this all the time, and this goes back to the assertive piece. I'm the one paying the doctor bill. If this doctor is not hearing me or hearing my child, hearing us, you fired. Next, because that is your right. And that is part of advocating for your child or yourself. So if I go see a therapist and they are not, really hearing what I'm saying, really helping me get to where I need to go, then that is not the right fit. And that's okay. And a good therapist is going to want you to do that because they're going to want what's best for you, both ethically and just, personally.
Yeah. So when you're calling to look for a therapist for your child, ask them what screeners they use. A couple of good ones. The CAT screener, which is the Child and Adolescent Trauma Screener. It's pretty inclusive. Just ask them what screeners they plan on using and then do some research and see if you feel like that's good enough for your child and what it is that you're looking for.
For sure. That's an excellent tip. So a lot of the things that you said are certain overlaps with some pretty common diagnoses that we talk about in here. So talk to us about if our child has experienced a trauma. I know for a fact in this particular group, we have both parents and extreme kiddos who have survived major traumas, sexual traumas, abuse, things like that. And so it makes sense that some of these things would be attributes that their kids or themselves are experiencing. So what are some ways that we can kind of help our children outside of just getting them treatment that they need, whether that be medication, therapy, ongoing, whatever, academic, so what I'm looking for, accommodations. But what are some other things we can be doing to kind of support that healing process?
Yeah, so I always go back to the basics, Maslow's hierarchy of needs. That bottom one is food, shelter, water. So if you have a kid who's coming to you from foster care, so if you're an adoptive foster parent, whatever, making sure that those basic needs are met first. And the same in your own home. You know, if you need to reach out to resources to make sure that you have good food and water, shelter for your kids, you can't do anything until those needs are met, because your kid's brain is going to be on fire with cortisol, wondering when their next meal is coming.
That's right.
And then the next two on his hierarchy, I think, kind of go hand in hand. It's safety and love and belonging. So I think then it's creating an environment where your child can feel safe and feel loved. And I think those are the most important things you can do as a parent. And I think this is just my own opinion. Some therapists will strongly disagree with me. But I think that those are more important than even consequencing behavior when you have extreme behaviors in a child, because you're not going to be able to teach your child right and wrong, good and bad behaviors, good and bad choices, however you want to word it, until they feel safe and loved.
100%. And to that point, this just actually came up last night in one of my, it was a testing and assessment class. And of course, my experiences are different as an extreme parent and as someone who could basically be the parent of my cohort members, because I'm so old and they are not. And so they were kind of focusing on this person's presenting issues and saying, well, let's not focus on the negative because that's going to make her feel bad. Let's focus on the positive. Let's praise her. And I spoke up and I said, yes, that's so important. However, I have an overflowing bin of star stickers, smiley faces, toys from the dollar store for my kid. And that does not hold a candle to me sitting with him in that moment of distress or fear or questioning or confusion and not saying anything, just being present, allowing him to express whatever comes out. It might be screaming, punching, kicking, biting, crying, or all of those things. It usually is. That is going to go way farther to make that person feel safe and validated than giving them a prize. And I think that's
100%. Yeah, I think one of my favorite types of therapies for children with extreme behaviors is Pcit, parent-child interaction therapy. I don't know if you guys have talked about that much in your group.
We haven't.
Oh, it's huge. Get John Paul Abner to do a video for you because
he's
the expert. So what it is you don't even work on behaviors until you work on your relationship with the child, and you work on the relationship not inside the behaviors. So you spend 5 to 10 minutes every single day of just one-on-one time with your child doing child-directed play. You let them choose what they want to play. You don't ask questions. You know, you're not judging the type of play that they do. If they're like smashing toys together, it's not, don't do that. It's like, oh, I like the way that you're hitting the yellow block on the blue block. You just notice the things that they're doing, so the child is aware that you're paying attention to them, that they matter. So that time that you spend within that 5 to 10 minute window is just based on building a relationship with the child and building trust.
Yeah, that's huge. And I think it's important as parents or caregivers, whatever that capacity looks like. I think back to the boys in the group home, and it's like, or my kids in my classroom, I say kids like they weren't full grown adults, but coming out of prison, it's like, look, I don't care if you want to be a trash man or a daggone CEO. You better be proud of it. You better show up on time. You better do the best you can. And I'm going to be your biggest cheerleader. I'm going to have a whole shirt with your face on it. And you're going to see me over here like this. Because really, it's when we come down on our kids, especially, or people that we're giving care toward, that says a lot more about us than them.
Yeah.
And so how we assert ourselves, are we in a situation or environment where we're being triggered? And I talk about that a lot in this group. Like, I fully embrace, I know there are certain things that if my kids even say something to me, I'm 0 to 100 in a hot minute, because I'm already at a place where I can't. And so that is a huge thing, is carving out that time, even if it's 5 to 10 minutes. And
Yes.
this is about them. It has nothing to do with me. I'm not going to insert my opinions. I'm not going to punish them unless they're harming themselves or others. Like, this is about right here in this moment. And I think as parents, especially as extreme parents, and then also as parents who battle our own mental health needs,
Mm-hmm.
it is very difficult to just be present, even
Yes.
for 5 minutes. That feels, there's a lot of guilt with that. There's a lot of, I should be doing this or this or this. There's just that's a very heavy task.
It is. Yeah. And in PCIT, the recommended time is just 5 minutes a day. Because it can be difficult to carve out that time. It can be difficult to just allow the child to lead the play. It's counterintuitive as a parent.
Mm-hmm. Yeah. So talk to us a little bit about, I don't want to go over my time because, Zoom's going to cut me off because I'm too cheap to pay for it. Not only do we have foster parents, former foster parents, and adoptive parents in this group, but we have people that are considering working with that system. And as you and I have both seen firsthand, it is a very broken system, but we could say that about our medical system in America. We could say that about our mental health system, all accurate. But what are some things that we need to know if we have kids who have been a part of, we'll say, the system in whatever capacity? Because I think what we fail to recognize is, at any time, if they are a part of their system, if they're taken from their home environment, even if that was to keep them safe, that is a trauma to them.
Yeah,
So can you speak to
absolutely.
that?
Yeah. So we have to think about it like this. When we take a child out of an environment, even if it's something that we think is scary and unhealthy, neglectful, abusive, that's all that child has ever known. And again, this goes back to idealizing that abuser, that person who did whatever harm to them. That's their parent. That's what they know. That's the love that they know. So that's what love is to them. They have to be taught all over again what love truly is and what respect is and what safety is. So it's a trauma just being taken away from that. Because that's, it's like, there's this analogy that I really love. So when you come out maybe from playing in the snow, you're freezing cold, you want nothing more than to take a hot bath. But you can't, because it actually physically hurts to get in hot water when you're that cold. That's what it's like for the child. They want to be loved, they want safety, but they don't know how to have it.
And they typically are going to they're going to act out in some way, not always with extreme behaviors, but often, because that is an adverse feeling for them. It feels almost unsafe, even though what you're offering them is structure and safety. I mean, the boys would come into the group home and I'm like, here it is, like, these are your expectations. And there were kids that were coming in there that have had never once in their life, they're 17 years old, no one has ever expected anything of them. Nothing. Yeah. Not to pass a class, not to show up on time, not to do actual hygiene, like nothing. Yeah. Whether it's not been taught to them or not expected. And I was like, listen, not only am I going to expect this, I'm going to hold you to it and I'm going to check in. Yep. And so that is a way, and I always say the difficult populations, specifically juveniles, are my favorite because they can see through your BS like from a mile away. It's my absolute favorite. That's why I love them.
Yes.
And because they know, they've been in the system. They know if you're there for a paycheck, which is laughable, or if you're there because you actually care about them and you want them to succeed and believe they can. And so I think if that's not your motivation for being a foster parent or an adoptive parent, you're in the wrong business for sure.
Absolutely. Yeah. I remember one of the things that we did in residential, you have these expectations of them, and that's one thing for a foster parent, adoptive parent, residential, to have these expectations for the kids. But then we take the time to show them, like, so this is how you take a shower. Like I remember in the day room for one of our groups, we have like this washcloth with our clothes on, and we're like, you rub your armpits, you rub all your private areas. Like, this is how you take a shower. Then you put your deodorant on and brush your, you take the time to teach them those things because no one ever has.
Yeah. And I think it's important to note, because we do have parents in here of all varying ages, very, very young to adults who are still living at home or still need some type of care. This is not, I mean, in some cases, but in many, these are kids that are not just high functioning, they're wildly academically smart and capable. They just never applied themselves. So it's not that they had a developmental delay and therefore could not take care of themselves. This was just straight up, no one ever cared to teach them, or it wasn't a part of their life.
Yeah.
Yeah, so that's important that we recognize that sometimes they need that. Just as, as parents, we're having to have difficult conversations with our kids. Like, our son is 9.5, fourth grade.
I can't believe he's 9.5.
Right. He was born, y'all, to give you perspective, he was born when Stephanie and I worked together. So, and my assistant manager, the guy that was as my assistant manager, dressed him up like a pea for Halloween, and it was maybe the cutest thing that ever happened. He was like his head was one of the peas in the pod. So cute. But anyway, so my husband and I've had these conversations recently, like, okay, we're going to have to talk to him about sex, which is totally an open conversation in our household. I mean, that's a conversation for a different day. But even though we're only out of school 20 years, and that seems like not quite a long time because of, the inundation of pornography and having, little computers in our phones in our pockets, these kids are exposed to things much younger and
Yes.
way before developmentally they can process it, regardless of diagnoses.
Yeah.
And so these are conversations we need to have. Same goes for kids in the system who are more likely to have been exposed to these things way too young, whether in an abusive setting or just because it was available. And it's important for us to recognize, and I always relate it back to as adults. So I'm 38. I was told most of my life by people who loved me or were supposed to love me that I was fat and disgusting and, question every bite that went in my mouth and stupid, not going to amount to anything, blah, 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 all these things, which are things I still work through daily, minute by minute sometimes. Did that mean it was true? Maybe not factually. Did I believe it? 100%. So going back to that perceived trauma, if our kids are ingesting these things, and maybe we don't mean for it to sound some type of way, maybe it literally was wildly off base, but that's how they heard it. We have to meet them where they are. And we have to recognize that if they're internalizing it this way, that is traumatic to them. And that's where we are. So yeah.
And I think we have to create a safe space too, where our kids can come to us and say, that thing you said to me about eating the candy, that hurt my feelings. Like, here's why I was eating the candy. Maybe give you an opportunity to say, well, here's where I was coming from. I want you to be healthy. Just having open conversations about that, allowing your child to call you out on stuff like that.
100%.
And that's hard. That is so hard to hear it. But I think that's how you create an environment of trust and safety.
Yeah, my husband and I joke all the time, like, sometimes you want to cry and we'll burst out laughing because it's like our kids will humble us, oh man, in a hot minute. And sometimes it's because, like they say, because our house is probably too safe, it's like really, really funny, some of the stuff that our kids say. And we're like, oh gosh, please don't say that like in Sunday school. Or like, I mean, like, yes, it's totally fine to ask me is shit a bad word. Like, just ask me, it's fine. Yeah, we should probably just not say it. Like, but if you are saying it, say it here and like ask us questions, right? But specifically as it pertains to like sex and body parts and, wanting our children to be comfortable in their own skin, to be proud of their body and the sensations that it feels, and in our house, in a faith perspective, to understand God created us that way, because there is a lot of shame that's taught in the church. Let's just be real about it. And so I think it's important, as we talk about children of trauma, those things are all also part of their worldview. And so if they were brought up if you're living in a place, and I have people from all over the world, so I can't speak to your specific culture, but if you grew up in a place where maybe you're in a culture where religion has a very high priority, you need to consider what things what values are placed on your children or projected onto or around them, and how might they internalize those things and see themselves as a part of that. Because that's going to make a huge difference to how they hear or internalize what they see around them. And when we were growing up, it was like, well, do as I say, not as I do. And that's ridiculous. But now as we become more comfortable talking about mental health, which is great, though we still have so much work to do. I think our kids are becoming a little bit more comfortable asking difficult questions. But if we do not create that environment of safety, or we're uncomfortable with it, right? Because there are things that just because of how we were raised, we're like, oh, that's icky, or that's weird.
Yeah.
Please don't make me talk about this, right?
Yeah. Yeah.
But that's up to us, and our kids will feel that. They're
Yeah.
gonna know if, and so for our foster parents and our adoptive parents, first of all, thank you. And you have that extra layer of difficult because they haven't been with you the whole time. Or if you adopted at birth, that's amazing. But guess what? They took things on in utero. There are
Mm-hmm.
still going to be somatic responses, bodily responses. They're going to, and I preach this all the time, but if you haven't read The Body Keeps the Score, you're blowing it. But like, we internalize things like that, whether it's imprinted on our brains or in part of our body, and that will come out eventually in some way. So do educate yourself. Before we sign off here, what if you had 2 minutes with somebody that was in the foster care system or in the process of adoption or considering either of those things, what would you want them to know? I mean, obviously that's a loaded question, but what if you could just pull on their hearts, like, hey, as someone who's seen it, you need to know this going in.
Yeah. Oh my gosh, there's so much.
Yeah.
The first thing is, it's hard. It's really hard. And I don't say that to discourage you. I say it so you gear up for the fight. Because when you have this child come into your home, I've seen a lot of foster parents expect that child is just going to become part of their family culture. And that's not true. You have to understand where this child comes from, and you have to adjust your own family culture, which is hard because you want to be able to give this child what's best for them.
Yes.
I think, you have to know that you're going to have to work with the birth families. A lot of foster families are really scared of that. And let me tell you one thing, it can be so rewarding. If you are doing solely foster care, not foster to adopt, and you take in this child and you build a relationship with the birth family, it can be such a beautiful thing, because not only are you helping the child heal, you're helping that parent heal as well. Because there's so much intergenerational trauma. That parent, this is all they've ever known, most likely. This is how they were raised and how their parents were raised. And so you have an opportunity to really break a cycle here. If you're doing foster care for teenagers, so many people are scared of the teens. And let me tell you what, they're so much easier than little kids.
Yes.
You don't have to clean them up. You don't have to change diapers. They can clean up after themselves. They can help you cook meals. And it can be so rewarding, because otherwise, these kids are going out into the world and they don't know how to balance a checkbook. They don't know how to check their bank account. They don't know how to apply for college, find their own apartment. There are so many skills they need that you can offer them. And it's rewarding, because at first they'll fight you. They will. Teenagers are going to have some behavior problems.
But your bio teenagers would too, just FYI. That's
100%.
I was terrible. So
100%. But I've seen so many teenagers come back to the foster homes where they were, and they're like, thank you so much for helping me get to where I am. And, I have a job as a manager at the grocery store. I have my own kid now. There's a teenager that I had when she was in foster care as a case manager, and Lord have mercy, she was tough. She was a tough kid. And she fought me on a lot of stuff, but now she's got a good job. She's raising her own kid. She's trying to do things right for her baby.
yes.
And it's such a beautiful growth to watch. It's worth it. It's hard, but it's so worth it. And you maybe can't change the whole system. That's what I've learned. I can't. But I can change somebody's world. I can change somebody's.
Oh, sister, you're about to take me to church over here. I think what I want to a sticking point I want us to hear is, if we are considering our own experiences, because we are going to naturally view things through our experiences in our own lens. If you're somebody who has mental health struggles yourself, as a parent, as a grown adult person, consider the things that you went through, that you survived, or that were maybe done to you or around you that you didn't get to choose. That got you to where you are right now, maybe with diagnosis, maybe with the need of medication or therapy, name off all the things. How would it have been different? How would the outcome have been different had somebody played that pivotal role? Had somebody been willing to step in, been your cheerleader, been your advocate, maybe not necessarily adopted you or taken you out of your home even, but just been there. And so if you consider it from that perspective, how powerful is a foster parent, an adoptive parent, a big brother, big sister situation? There are so many ways we can make a huge impact on these kids. And I think there's just nothing like that. There's just nothing like it. I mean,
No.
if you ask me, I mean,
Yeah, there's a quote.
Go ahead.
No, there's a quote that I sometimes remind myself of why I'm doing this, because there are some days that it's really bad and I don't want to do it anymore. But be the person that you needed when you were younger. For whatever it was, like, you can be that person for somebody else.
Yeah, absolutely. Stephanie, I love you. Always have, always will. I'm so grateful for this time. I already am thinking of things I want to schedule to talk to you about in the future, because your breadth of knowledge is so important for this group. I'm so proud of you and so grateful for all you're doing and have done. And I just can't wait to talk to you again. Thank you. You guys check into the things that Stephanie mentioned. Go back and watch Dr. Browning's talk about attachment styles and childhood trauma. If there are specific questions you have, hey, I'm noticing when Stephanie was listing off all these different things that there were a ton I would have checked off for my kid. If you have more in-depth questions, reach out to me, Bryn, BRYNN, at themamaontherocks.com. And if I don't know the answer, I absolutely will ask Stephanie, or I will ask her about connecting with you, because sometimes they're just things that we want to know. And or maybe she can give you a recommendation for the type of therapist that might be helpful for your child, or the type of assessment that might be helpful for your child. So do reach out if you have further questions. But Stephanie, thank you so much for your time. I know it's so precious.
Thank you.
Wait to talk to you again soon.
Bye.